of delivery. We believe in putting you first because of our innate understanding of your needs to tailor-make products that can only add value to your lives. We believe in putting you first. That is why we have become your trusted partner. Trust Bank Gambia Limited. Proudly Gambian.
kurang la na kaspa
bi nga xamee ne amuloo kaspa bu dee lu tax nga naan ma yow seetaan see ko sa kër defal dakka ma ne def ma dakka maaj bi dafa important trop ci man te dama koy seetaani de
man mi sax suma kër laa dem seetaani ko aw nga benn
inca kaay dugalal ma suma kaspa bi yow
nii lan la ni
Qcell dafa indi lu ees lu ñoo wax Q power ak Q power mun ngaa recharge sa cash power through SMS
waa léegi su ma ko bëggee am suma kër nu may def
loo soxla rek mooy amal sa Qcell line soo ko amee ba pare nga registré si sa mita bi mun nga see registré bi ñaari mita soo registré sa mita gi ba pare dangaa xayma ñaata nga bugg a jënda nga yónnee ko si 333 dégg su fekkee ne nag Q power scratch card bi nga amee dangaa xoos pin bi nga yónnee ko ñu yónnee la sa code nga load ko am sa cash power sa lampa taal sa télé taal sa kër taal
xamat kon gaawal nga dem dugalal nekk si nga
xam nga nag li ma di wax Qcell daal moo di bakkan ku ko ñàkk dootul ñandu waaye Qcell moo di bakkan ku ko ñàkk dootul ñandu
The National Nutrition Agency, NANA, is a government institution tasked with improving the nutritional status and reducing malnutrition, morbidity and mortality among the general population, especially vulnerable groups such as pregnant and lactating women and children under 5. Established in 2000 by an Act of Parliament through the Food Act of 2005, the agency has metamorphosed into a highly viable state institution, placing nutrition as a top priority on government's development agenda.
NANA is established to ensure that nutrition as a whole is well coordinated in the Gambia, and it's well understood as well. Just to show Gambians that they have to mainstream nutrition in all their programs, that is all sectors of government, and also outside of government, that are related to anything we take in, which is nutrition. So that was one of the reasons. Also to educate people about nutrition. It's important to sensitize people generally, so that they know what nutrition is all about.
nutrition is a cross-cutting issue, and therefore to make an impact as far as nutrition is concerned, there need to be a higher level of coordination to read that the various players and actors in nutrition, their efforts are coordinated across the board. So that is exactly what the agency is doing. But in addition to the coordination, we also have the National Nutrition Policy covering 2010 to 2020, in which we are piloting and implementing some aspects of that policy.
It is against this background that the agency is working closely with all stakeholders, including communities and community-based organizations involved in nutrition and nutrition-related areas, to mainstream nutrition into other sector policies, programs and strategies, and better coordinate nutrition interventions in the country. The agency works closely with the Ministry of Health and Social Welfare at the regional level to reach out to communities.
It is very important for the Ministry of Health. They are supplying the Ministry of Health staff with these supplies at our maternal and child health clinics. So these are given to mothers under 5 by the health staff. And also this, in the case of complementary foods, they also provide materials and all the gadgets needed for conducting cooking demonstrations at nutrition centers, because here we have 2 nutrition centers, one at Bansang Hospital, one at Nyanija Chamin. So in all these centers, they are working with Ministry of Health to supply the foods necessary to, give to these malnourished kids to, gain the health status.
Until recently, nutrition was not recognized as a major development ingredient, and interventions in the area were largely negligible. But the steep rise in malnutrition amongst women and children forced a rethink in policy, culminating in the intervention of development partners such as the World Bank, which provided a $3 million grant through the Rapid Response Nutrition Security Project.
The reason that we are interested in nutrition really is because so much evidence has now shown the direct relationship of good nutrition and good development. And just to sort of indicate a bit of the kind of evidence that we are having, first of all, we know nutritional deficiencies, which come in many different forms and shapes. It's not just thinness, as you may know it, but many hidden nutritional deficiencies. What really triggered the bank to move further, to seek dialogue with countries, is the fact that these various nutritional deficiencies occur in the very early stages of life. During pregnancy, the first few years of life. This is exactly the period that the brain develops.
In order to achieve its desired goals, the National Nutrition Agency, as the implementing partner, operates through 5 main program areas at community level. This is an integrated approach that seeks to involve communities in the planning and execution of programs to achieve maximum returns. These strategies are the Baby-Friendly Community Initiative, the Baby-Friendly Hospital Initiative, Micronutrient Deficiency Control Program, Nutrition Education Program, and the Non-Communicable Diseases Strategy. The Baby-Friendly Initiative, or BFCI, is a community-led initiative that empowers communities through capacity building to identify nutritional problems and address them, in addition to preventing malnutrition among their members. It's operational in over 600 communities countrywide.
The package looks at maternal nutrition from the time the mother conceives. There are certain advices that the breast support groups will give, and then when the mother delivers, they will also advise the mother to initiate breastfeeding at the earliest possible time, so that the child can benefit from the colostrum, and also the early initiation of breastfeeding also brings about bonding.
They have been trained to such a level that it makes life very, very easy for regional health office in terms of implementing their activities, not only NANA activity, but other